A gastric sleeve is an operation where you reduce the size of the stomach using keyhole surgery. After this procedure, the patient is left with a long, thin stomach of much smaller capacity, hence the name sleeve.
There are fairly clear guidelines which help determine who is suitable for weight loss surgery. For people who are eligible for surgery, which would be a BMI of 40 plus or a BMI of 35 plus if they've got some weight-related problems such as diabetes, the risks of carrying those diseases or the risk of developing those conditions are higher than the risks associated with the surgery. In other words, it's safer to have surgery provided they lose weight and maintain weight loss than not.
Based on the person's medical condition, weight, age, we can predict who are the patients who are more likely than others to run into trouble, and then there's various precautions that we can take.
The risks of gastric sleeve surgery are very small indeed. Very occasionally we see a leak from the top of the staple line. This can usually be managed without a further operation and does eventually heal in time.
There is some soreness from the various keyhole incisions which have been made. Most people need to take simple painkiller for 5 days or a week. I recommend to my patients that they plan to take 1 to 2 weeks off work, but at the same time I encourage them to be as physically active as possible.
What we do see with the sleeve over time is that the sleeve will become more accommodating, and so the meal volume people tolerate will increase to a degree, and that's obviously beneficial in terms of being able to get appropriate nutrition in.
It's usually liquids only for the first 5 days or a week, followed on by taking very soft, very sloppy food and building up to taking normal food by around 4 to 6 weeks after the operation.
The weight loss results with gastric sleeve are excellent and its safety profile is fantastic. It's an operation that is emerging internationally and is now probably the most commonly performed operation for those desiring weight loss.